Well, welcome to our First Lutheran Church Adult Forum for today. I'm Pastor Heidi Heimgartner. I'll serve as facilitator this afternoon, but I would also like to introduce my awesome Blossom colleague, Pastor Mike Walerius. Maybe you can wave so people see who you are. He will be assisting us this afternoon. We are joined by a very stellar group. Some members, some friends from around southeastern Minnesota, all the way to the great state of Texas, as well as a number who are joining us via the recording at a later time. So welcome to each one, both live on the call and those in the future who are viewing and learning too. Today you are participating in a panel event titled Personal Experiences with COVID-19. So a few ground rules for this Zoom, and I think they're pretty standard these days as we're all learning this technology. There is a mute function, and so I would invite you to enable that at this time. It does keep the background noise to a minimum. So unless you are called upon, please keep that audio on mute. There should be a red strike through on your microphone icon. And if you can't locate it, sometimes that means it's hidden in a tray. And that's especially true if you have a smartphone or a tablet. So just kind of hover maybe above, or mine's below on an iPhone device, and it might appear. And then you just click that and the strike through will come, and then you'll know you're muted. Many of you also may be familiar with the chat function on Zoom. That is also in your tray, and that is where you can interact by typing. So the chat will be monitored for questions, and we will try to review that periodically to get to as many questions as we can while still respecting the time frame of 1 hour that we've set together. And then finally, a reminder that we are recording this Zoom. So if you find this hour helpful, chances are other people are going to too. First Lutheran does plan to share this resource with congregations of the Southeastern Minnesota Synod, and then it will be archived on our YouTube channel. And I will share that with our panelists, so we want you to know you can feel free to share that as you would like as well. So now I think we will begin. This forum, Personal Experiences with COVID-19. Each speaker has been given a time frame of 5 minutes to share based on their area of expertise and personal experience. And the goal for this event is pretty simple. We believe empathy is the best tool to navigate the pandemic, and it is best achieved through personal experience and sharing. So sound science, sound information is helpful, but engaging both the head and the heart has the most impact. And 6 months into this pandemic, I think it is our duty as people of faith to listen deeply and to open ourselves to growth, as well as just simply find space spiritually, emotionally, and intellectually together. So after the panelists sharing and some mutual conversation, we're going to conclude this hour with prayer. With that, I will introduce our first speaker for this afternoon. Our first speaker is Amy Evans. Amy is a daughter of First Lutheran, growing up here, and she is now a member of a sister Lutheran congregation. Over the last couple of decades, Amy has held several roles related to public health. For example, she managed the H1N1 pandemic in 2009 in our area, and currently Amy serves as Deputy Incident Commander in a county public health department. Amy, thank you for being with us today. I'll turn it over to you.
Great, thank you. Thank you everyone for joining. Yes, as Pastor Heidi had alluded to, I'm currently the Deputy Incident Commander for our county health department. My day-to-day job is an emergency preparedness coordinator. The pandemic that we had in 2009 for H1N1 was what I thought was going to be the pandemic of my career. Little did I know we would have a much more significant pandemic. And so as a planner and somebody that is responsible for how our agency responds to events like this, it has been something that I never thought all of those plans that we put in place would actually come into fruition. We have had numerous turnover in our agency, so going into this, it was a little nervous with new leadership in our department, with some having a lot of background and some that have had very little background, very little training. It's felt like a lot was weighing on my shoulders at the beginning of this. As a public health department, we are typically a silent organization within any type of community. The idea behind public health is to do things that you don't necessarily have to see on a day-to-day basis. However, many of us know what public health is in the context of disease investigation and making sure that we can stop diseases, as well as safe water, healthy children, lots of different things. And so for us, when it comes to emergencies, we look at primarily the focus of the health aspect of people. And very seldom do we see infectious diseases rising to the level of something like what we're having with COVID-19. So what our department has done is, Pastor Heidi alluded to, I'm serving as a deputy incident commander. At the beginning of this, in February, we activated our incident command structure, a system that we can use to organize things. And with that, I was incident commander, and during that time frame, I did some things that are outside my normal comfort zone. One of those things, I always said that if I was going to be a nurse, I need to be in emergency room, because I needed to not have that day-to-day connections, those long-lasting relationships with families. And so early on, in addition to building on the relationships with our healthcare partners and developing a testing strategy that has become one of the most unique testing strategies, where healthcare partners and public health are involved, we are very proud of the things that we've done. However, it hasn't come with some challenges. And one of the things that I did in the very beginning was case manage and identify and work with those organizations that had their first cases, including a long-term care facility. That long-term care facility probably ate at me the most. We knew across the country that once an individual had COVID, they would probably spread it to others in that facility. And we saw that across Minnesota in many facilities. My job was to check in with them every single day, check in to see if they had the appropriate personal protective equipment, how were their staff mentally handling the situation, did they have enough staff, how were the cases, were they being able to maintain those cases. This facility also saw the first death in the county that I work in addition to subsequent deaths. We also had coworkers who had family members there, so it had multiple layers on that. I did this for about 2 months, managing the day-to-day overall command objectives, looking at this from a strategic perspective, keeping our leadership informed. But over the course of time, we have been activated recently. We've identified it was over 200 days, and we are starting to see not only myself, but many of our staff and my coworkers that are really just, this is a 7-day-a-week operation, and it's exhausting. There isn't a day that goes by that we sit there and wish that this would end. And really having that fear, we know of individuals across the country that work in our field that have had death threats, that have had to quit their jobs because of a lack of support. And so we've been fortunate in our county to have that support. However, not to show that this is something that is taken lightly, and many of us are worried how this is going to play out as far as our careers. You know, when you're doing something long-term and in the context of disasters, it is mentally, you need to look at that piece of it. And we are at a point now where the mental health, not just on our staff, but also in the community, is becoming a bigger issue. So with that said, I will turn it over and take questions later.
Thank you very, very much, Amy. And thank you for everything you're doing at the county health level, public health level. We're going to have all of our speakers share just, one after the other consecutively, and then we will have our time for questions, as I mentioned, if you just joined. So our second speaker I'd like to introduce at this time, her name is Crystal Studer. Crystal is a member of First Lutheran, I think your whole life through. Yeah. And she and her family are volunteers that are part of our ministry in lots of various ways. In fact, Crystal is so dedicated that she's been here twice today. First to celebrate her son's communion milestone. We did that at about noon. And then she came back after the party to be present for the Zoom. Crystal's life work is nursing, and she currently serves as nurse manager with a local hospital. So Crystal, welcome back. And we invite you to share.
Thanks. Well, like Heidi said, my name is Crystal Studer. I'm a mother of 3 small children, all in elementary school. I've been married for 15 years in this church, First Lutheran, and I am a registered nurse in Minnesota and working as a nurse manager. So Heidi first asked if I would talk about how the pandemic has affected me personally and professionally. And I think much like everyone else, I'm on a roller coaster of emotions. Like Amy had shared, many days I just wish it would go away like everyone else does. Many concerns for anxiety in myself, in my family, fear, worry about my children's education and staying in school, financial well-being of myself, our neighbors, our friends, our small businesses, continued childcare. Every day I just hope and pray that I still have childcare. And then again, like Amy had said, mental health of all. Although there has been some silver lining, we have people getting into mental health with all of our virtual capabilities now that weren't able to get into before. So there is a silver lining with mental health. My recommendations for others and what me and my family have been using is being grateful and being flexible. Every day that we don't get COVID is a blessing. So we're learning to trust in the recommendations coming from the experts, obviously in prevention and in treatment, as someone in my personal family has been affected by COVID, and we have been on quarantine twice, and then recovery, because there is long-lasting effects, and everybody recovers differently. So what I choose to focus on is things within my control, and that's keeping myself and my family educated. There's very many sources that are not reputable. Don't go looking for your information on Snapchat or TikTok. My kids love the World Health Organization has a live dashboard, so you get real-time numbers and you don't have to wait a week or 2 weeks. We do a lot on Department of Health, but there is more of a lag there, usually about a week, I think. And doing our part to slow transmission. We are a big family of campers, so early on in the summer, we could see that this was not going to be a sprint. We were in a marathon, and what we once thought would be done by June at the latest, now we started thinking we better plan. So like anything, we wanted to help our kids learn the skill of masking. Working in a hospital myself, wearing masks since March, it doesn't faze me anymore. That's just part of what I wear at work. And if you're feeling grumpy, nobody even knows your face is covered. So we started having the kids wear masks every day, 30 minutes, an hour. We are a big camping family, like I said, so we go hiking, and my 4-year-old daughter just wanted to leave it on because she didn't want her mask to get dirty. So I feel like we've perfected that skill. So obviously masking, hand washing, and social distancing. I have had experience personally and professionally where the person sitting next to you didn't know that they were positive, didn't have symptoms until a day later, and I was with them the day before, but because we were masked and socially distanced, I didn't get it. I've been in more than one of those situations, so I'm doing my part to slow transmission that way. And I really don't want to be stuck at home, working from home for 2 weeks. Being kind to others, there is no perfect solution, and all of us are just trying to do the right thing by ourselves, our families, our place of business, our neighbors. So offering other people grace, you know, what would have been something we would have done 6 months ago isn't the same. I think of my daughter. We just went to the park for the first time, and a little girl came up and was in her personal space. And before she would have asked her to play, and now she said, "Can you back up a little bit?" And it just feels so different. And coming up with new games for kids to play and kind of learning to navigate that. And then we're really trying to focus on exercise because we are not an exercise family, but we love to move. And we all know the mental health benefits from exercise, and it helps drive down the anxiety. So we've become hikers and bikers this summer, and we could become skiers this winter because we all have this feeling of impending doom going into winter. So I told my husband he does not ski, but he has two options. It's either learn to ski or learn to tube, because I'm signing us up. And then, like Heidi had said, professionally, I am a nurse manager. So prior to COVID, I spent about 80% of my time in an office, in meetings. When COVID first hit, obviously, I got to come right out onto the floor, running drills, making sure everybody was aware of how perfectly you have to put on and take off your personal protective equipment, because it's so contagious. And we've really had to offer our teammates flexibility, again, resiliency and empathy, especially in March. I have a really young unit, so most everyone has children. So every day people are worried about their home life. So offering people empathy so that they can take care of our patients. And then obviously extending that to our patients too. I mean, imagine having a sick family member in the ICU. And when you would normally take shifts and have 6, 7 people in the ICU, for a while, you got nobody. You could Zoom. I think most area hospitals now, you can have at least one. Same with a baby. I'm in an OB unit, so we were really lucky that no matter what, you were always allowed a support person. But many people's close family included sisters, aunts, neighbors. So it's been hard not being able to celebrate with everyone. But again, we found new ways to advance our technology. So that's been a blessing. Yeah, I think that's about it. Like I said, we've been in this for about 6 months now, and I feel like we're really lucky in the area we live in, Minnesota, as far as personal protective equipment and the pandemic planning. I didn't even know that was a thing, but when other parts of the country worried about running out of PPE or personal protective equipment, we were in a really good place here with really good health care. So yeah, I feel pretty good personally and professionally today, but as I said, tomorrow's a new day and a new roller coaster ride.
Thank you so much for sharing all of your life with us, both professionally, but also the human side of that with your children. I really appreciate that perspective. Our third panelist today is Paul Heimgartner. Paul has been a member of First Lutheran for the past 20 years and has volunteered in lots of different capacities in that time. And since about, I think, 1996 or 1997, Paul has worked in molecular biology and laboratory science. Don't ask me more than that. I do not know, but he can share it with you. This spring, Paul took a voluntary redeployment to a regional laboratory that diagnoses COVID. So Paul, thank you too for joining us, and now it's your turn to share.
Thank you, Heidi. Just a little bit of the background for me. I work in a molecular laboratory, and I've now been redeployed into a laboratory where we strictly do COVID testing all day, 24 hours a day, 7 days a week. And I just want to give a shout out to all my colleagues too that are covering my job back in my home lab. So they're taking care of my duties while I cover other duties in the other laboratory. And just to note for all your viewers, this is September 20th of 2020. And I say that only because the evidentiary evidence is accumulating for COVID, and the testing and our experiences are changing rapidly in this. So I'm going to just briefly touch on a couple of things for the testing that are going on right now that are changing. And for me personally, it's been a change of both getting to work, traveling, commuting, working with a whole new group of people, wonderful people in our COVID molecular lab. And we're doing one of the most sophisticated tests available for COVID testing, and we're doing the molecular test in our laboratory. There are 2 other tests available for COVID testing, and those are the antigen-based tests, which are really just at the forefront of coming out and being available to more of the public, and also the antibody test, which is a post-infection screening tool where we can see if patients have been infected and have an immune response to COVID. And I think one of the clarifications that I just want to make going forward is we often hear that we just need more testing and we need more testing. And that's true all around. And that's true for all three areas of those testing. And so I can speak in great deal about the molecular testing and with some authority to the antigen and antibody testing as well. My experiences have been less direct than some of the other people that will speak on the panel today. But I do want to say that I've heard multiple stories of people who have been ill, people who have recovered, and people who have been ill in their own home and not infected their own families even. Just this week, I was speaking to a man. We were going to look at a car dealership, and he expressed his concern about COVID and how he had been infected with COVID and also then quarantined himself for 14 days in his basement and not infected his family. Just used precautionary measures as masking and separation and was able to not basically infect his family. And I think that was an important story because it shows that we can still be in close congregation with each other, but using those tools of separation and masking to help prevent the spread of COVID. And then just his utilization of the care that he was able to receive through his care providers helped him to both diagnose and know what to do. And so I would say if you're ever in a situation where you're unsure about what to do, there are always resources out there for you, whether it be your physician or another healthcare provider, to give you access to good information. And some of them might be reached by phone or by Zoom or by other method, and not in person. Right now, one of the advents of diagnostic testing I just want to touch on is the antigen-based test. The antigen-based tests are just being provided to the general public. Some of these have been provided on a more expansive scale, such as the NBA and so forth. Some of these tests may not have the sensitivity or specificity of our molecular, more complex tests that we do in laboratory, but they provide a different tool in which we can both screen and assess individually whether we can go out in public, or also what kind of preventative measures we should take to stop the spread of COVID. So that's about all I have to have for an intro right now. So if you have any follow-up questions, I'll be happy to answer them later.
All right, thank you. I told Paul he couldn't get too much into the details. So make sure if you have detailed questions that you ask him. Our fourth panelist today is Lisa Sandgren. Thank you, Paul. Lisa is a former member of First Lutheran. She and her husband now live and serve in a sister congregation where Lisa recently took a position as interim faith formation director. This is the first I've said it, so congratulations to you, Lisa. Unfortunately, like so many thousands in our state and millions worldwide, Lisa contracted COVID-19, and she was bravely willing to let us on that experience. So I just want to say at the outset, we are so glad you're feeling better, Lisa, and it's now your turn.
Well, thank you, Heidi. And as she said, I'm Lisa Sandgren. My husband, Jeff, was an interim pastor in Blooming Prairie in 2018. And after Blooming, we moved to Faribault, Minnesota, where he serves at Our Savior's Lutheran Church. And September 1st, I became a staff member. So I'm an interim faith formation director, as our faith formation director is a seminary student, and she is doing her internship in Dodge Center, Minnesota, and her supervisor is Heidi Heimgartner. So we go in all these circles, you know. Anyway, back during the time when COVID hit, March 15th was an important date to us because our second grandson was baptized that day, and we were together as a family minus our son and wife who live in Oregon. But our 3 daughters were all together for the baptism. We were down in Spring Grove, Minnesota. And during that worship service, the superintendent of their school district got the message from Governor Walz that school would be closing down. And it was really emotional because we were all kind of feeling like, oh, what's going to happen? Well, we went through the next couple of months. I was working at a bank as a bank teller in Northfield, and the bank was shut down, and if we were working, our team, all the employees were divided into two kind of teams, and half of the team would work 1 week, and then the other half would work the next week. So we were able to be on 1 week, off 1 week. And then our bank was closed to outside customers, and we were doing everything through our drive-through banking system. So I felt at that time that I was, fairly safe. We were wearing masks and staying away from each other. Our workstations were far apart and whatever. So but otherwise we stayed home. We didn't go anywhere. And if we did go someplace, we went with masks. And so on May 29th, it was a Saturday, it was Memorial Day. It was after Memorial Day, I guess. And it was going to be the first time that we had been able to get together as a family with our 3 daughters and our little baby grandson. We were very excited. And one of our daughters actually, at the beginning of May, called off her big wedding. She still got married at the end of June, but at the beginning of May, she sent out a note to everybody saying, the wedding will not be for everybody. It was just going to be for family. So we, on May 29th, we had the girls and their significant others with us. We were just celebrating being able to be together after 2.5 months of not seeing each other. And we were careful. We didn't do a lot of hugging or sitting close to each other. We spent time outside, and then we we were together maybe a couple of hours that day. The next day, May 30th, our best friends were just happened to be driving by Faribault, and they said, could we stop? And we met them in our backyard. We socially distanced, we wore masks, but it was really fun to just be together and see them. Monday, June 1st, I woke up with a really bad headache, and I don't get headaches, so I'm not a person that deals with that often. And I thought, wow, this is really strange, but I thought maybe I'm a little dehydrated, maybe I'm hungry. I ate, I drank, and then I proceeded to go outside and mow the lawn. After I mowed, I came in to take a shower, and I could hardly lift my arms up to my head to shampoo my hair. And there were several times that while I was in the shower, that I felt like I might just kind of fall over, and I had to kind of stop and hang on to the wall for a minute and try to steady myself. And when I got out of the shower, I took a 3-hour-long nap, which I don't usually do, but I slept very hard, and it was really hard to wake up and feel kind of fully present. The next day, when I woke up, that was June 2nd, I felt very achy. I had muscle aches all over my body, kind of the same headache, and it just felt nearly impossible to get up out of bed to go to the bathroom. I just couldn't wait to get back into bed. All I wanted to do was just lay in bed. So that day, Jeff came to me and said, that he wanted to drive up to Minneapolis to go to the area where George Floyd had been killed. That had just happened a week earlier. And I said, well, I don't think I can get out of bed to go. I just don't feel good. And I'm achy. I just don't feel good. And he was the one, you know, I didn't even think of COVID, but he was the one who said, I think we need to call and find out what you should do. So we called. I was sent down to Owatonna to their drive-through testing spot and was tested. And the next day, so that was Wednesday, June 3rd, I got that positive diagnosis. So I then we were both quarantined, both Jeff and and I stayed in our bedroom. He slept in the other bedroom and spent most of his time on the first level of our home. And he was able to make me meals and things and bring them just to the doorway. And then I would take the meals and eat them in the room. I never left my bedroom for 21 days. Yeah. So, and during that time, I felt confident in my care. We receive our medical care through Mayo Clinic, and I was sent a whole kind of a home testing kit. I had a blood pressure cuff and a pulse oximeter, temperature. I was able to do all these things, and it was all hooked up to their computer system so that they got all my results instantly. And like one day, I just remember I was talking to my mom on the phone, and we were having a little bit of a heated discussion. And at the same time as I was talking to her, I had to take my vitals. So my heart rate was elevated that day, and they called immediately and said, why would your heart rate be that way? I said, well, I was talking to my mother on the phone, and they said, okay, let's retest and see if and I had calmed down by then. Anyway, so then after 2 weeks, I was told to go back and retest. That was partly because I have rheumatoid arthritis, and they wanted to make sure that I was fully well, and they wanted me to have 2 negative tests 24 hours apart, but 2 days in a row. So I went on Monday the 15th, had a negative test, went on Tuesday the 16th for the second one, which I assumed would be negative, and it was positive. So the difference between the 2 tests was the person administering the test. I felt like the one on Monday, she barely went into, she stuck that in, and I thought, oh, that wasn't so bad, as I had remembered the first one being. But that second day that I had it, she really stuck it in and rooted around, and that came back positive. So then I had to be quarantined for 72 more hours and do the same thing again to have the 2 negative tests in a row, which that's when it finally came back. So on day 21, I was finally free from quarantine. During that time, Jeff was also having symptoms and went and was tested 3 different times and never tested positive. So,
what they said.
yeah, he's in the background listening to me here. But he was told it's really almost impossible for you to have remained without COVID while being in the same house as we were, in the same place together. So while he never had a positive diagnosis, we kind of feel like he also had the disease. One of the things that I just wanted to add was part of the mental duress during having COVID. I kept waiting for the time when I was all of a sudden not going to be able to breathe, where I was going to have to go to the hospital and be intubated. And I was just very afraid during that time. I'd wake up in the middle of the night, you know, and kind of, can I breathe? Can I, you know, do I feel anything unusual? And thankfully that never happened. I am very thankful that I had what I would call a mild case. Although I did feel, you know, even after being released from quarantine, that I was very worn down. I just kind of felt like I'd been hit by a truck all the time. So, and then the other thing that happened to me was I lost my sense of smell, and it is coming back, but I still am experiencing, you know, like Jeff will say, oh, smell, this really smells good, or what he's cooking or whatever. And I'm like, sorry, can't smell it. So it has to be a pretty strong, usually a more unpleasant odor for me to be able to smell it. And I have to, excuse me, I have a fly flying around my face. I have to be pretty, like my nose right into it to get any kind of a sense of smell of what it is. So I am very thankful, you know, that I felt like I had good medical care while I was sick, and thankful to Jeff and to people in our congregation who were helping provide meals and, you know, just sending words of encouragement always, just being so attentive and sweet with their kind words and prayers. And I guess, and the other thing that just made me feel really good was that none of our family got sick after being with us on that first Saturday, which we just felt very, very lucky that nobody else caught it from me that I know of. So.
Thank you so much, Lisa.
Mhm.
We're going to move on to our fifth and final panelist. And our fifth and final panelist is Bonnie Petrie. Bonnie is a personal friend of mine. She has ties to a sister Lutheran congregation in way upstate New York. Maybe she'll tell us where exactly, but she makes her home in the Lone Star State these days. And Bonnie is a medicine and bioscience journalist, and she hosts a weekly podcast for public radio on COVID. And I happen to know that she would say she isn't, but she is a whiz at Zoom. I've seen her skills in action. She's a whiz at many other things too. So thank you, Bonnie, for providing experience and context from your point of view with media, with national trends, or any other things that you'd like to speak about. We're going to give you the floor.
All right, great. My mom's church is in Western New York, near Buffalo, in a little town called Farnham, and that's where their family's gone to church for generations. So that's the area where I'm from, but I'm in Texas now. And it is such an honor to sit on this panel with experts of the sort that I seek out and interview every week for my show. And in your own way, all of you, you're on a warrior's journey, and I really thank you for sharing your stories. So I'm just a conduit for information, really. As a bioscience and medicine journalist, I call myself a translator. If I have a gift, it's the ability to take the super smart stuff people like those on the panel might say and put it into regular English that other people can understand. So that's what I do. And I love doing that. And normally it's not controversial at all. I get to explore research and discoveries and their impacts on the lives of real people. And I've almost never gotten any pushback that people who report on other beats generally do expect. So I gather and research and verify and analyze and distill and share science. Seems cool. It is cool. And it seems like during a pandemic, people would be really hungry for this information, and many people really are. But this year, when good science is so important and it saves lives, the polarization of the population has sort of spilled over onto my beat. So, you know, sometimes you hear that you're fake news. And so how do you fight that? You need to get the information out, but a certain percentage of the population is sort of predisposed to dismissing what you're sharing about masks or about social distancing or large gatherings, or, kids can't get it, so send them to school. And COVID-19 is a hoax, right? And that can get tiring. So what I do is kind of what we're here to talk about. It's about empathy. So in addition to getting the best expert information possible, I look for regular people, people like me or you, to share their experiences with the virus. I talked to a farmer in his 50s who was on a ventilator for weeks, and he beat this virus, and it was a powerful story. But then he, like you said, he still can't taste his wife's Tex-Mex, and he has to sit in his truck and watch his kids mend the fences, because despite only being a couple of years older than I am, he doesn't have the breath to work or the strength or the energy, and he feels powerless. And then I talked to a mom in Montana who's terrified her 16-year-old son, who has really bad asthma, but it's currently controlled, but she's afraid he'll get COVID and possibly the flu because people won't get their flu shots and they won't wear their masks. And she's afraid that he'll get sick and that he'll die. And then I talked to a doctor who treats the very sickest COVID patients. He treats dozens of them every day, including, he was surprised to go in on his rounds and discover that under the ventilator was one of his good friends. He and this friend started their careers in an ER together decades before. And the doctor updated me on this story almost every day about his friend's progress until there was no more progress. And then his friend started deteriorating. And then this friend, who was a nurse right around my age, died. So I wrote this story. And while I was writing it, it felt like something in me broke. So I was writing and I was sobbing, and it was about the doctor, and he was so vulnerable sharing this story and his feelings about it. And it was about the loss of this nurse who fought so hard against this jerk of a virus and ultimately didn't win. So what's even the point of all this? What's the point? Maybe there isn't a point, I was thinking. If no one's listening, if I'm fake news, then I'm just screaming into the abyss. And why do that? So yeah, it was like something breaking in me, because reporters are people too. I started covering this virus in January, and I have covered nothing else since. In April, my aunt died, and I kept reporting. In May, as Heidi knows because she spoke at the funeral, my brother died. And that was hard. And I tried to mourn him, and I keep mourning him. But there's still this pandemic, right? It's still everywhere, and there's still work to be done. So I worked, and I tried not to get sick, and I tried to keep my daughter safe, and I tried to keep her life going in some way while still reporting on people's pain and their grief and their loss and their sadness and their anger, because that's part of what I do too, is bearing witness. So while I was bearing witness for this doctor and this tireless fighter against the disease, who's working at a hospital on the southern border of the United States of America in Texas with not enough of anything to do his job, but he was still fighting so hard to save these people and his friend, trying everything, and he was struggling, and he watched his friend weaken and still fight and fail and then die. And I broke. I broke then for my aunt and for my brother and for my daughter and for the doctor and for his friend. And of course, the well over 100,000 souls who've left this earth because of these insidious bits of protein and RNA. So the people on this panel, the people on this that I interview, and the people who have died of this disease, they're not fake news. They're not involving themselves in culture wars. They're not promoting any political candidate. The experts here are just trying to save lives. Those who share their stories are trying to help others and save lives. And the nearly 200,000 people who've died are not fake either. Each one of them was once somebody's baby. Their mothers and their fathers and their grandparents and their children and their siblings and their husbands and their wives and their friends, and they're gone. They're really gone, and they're not coming back. And it's really this disease that killed them. So I thought then that I might quit. I thought continuing to try to get inside other people's hearts and their minds and walk in their shoes and tell their stories might kill me eventually more efficiently than any virus. But I'm talking to you because I didn't quit. Someone needs to bear witness. Someone needs to tell the stories. And I'm not a scientist, so I can't develop a new treatment or a vaccine, and I can't deliver personal protective equipment and nurses to every hospital in America that needs them, and I can't make schools safe, and I'm not a doctor or nurse who can administer potentially life-saving treatment or hold anyone's hand as they slip away. That's a problem with this pandemic. You know, there's so much I can't do. I feel pretty powerless, like I think probably a lot of us do. But I can tell stories, is what I decided. That's something I could do. So I keep doing it. And I think maybe that's the way we all get through these trying times in our lives. Just find that thing that we can do to help, whatever it is. We all have something. So find that thing and do that thing. Even if it's just taking a moment to honor those who died of this virus and remembering them, that they were somebody's baby and that they mattered. And look around and remember, yes, we're all somebody's baby. Everyone here in your little squares, we're all in this together. We'll all get through this together. And that's the point, right? That's the point. Thank you.
Thank you so much, Bonnie and Lisa and Paul and Crystal and Amy. I don't think we could have convened a more amazing group of informed and caring citizens and human beings to share their experiences. So again, I want to thank you. We are limited in time. We have about 13 more minutes, and I do want to tuck away at least a minute and a half at the end so that we might pray. I also want to be respectful of time. So again, you can type your questions into the chat if you would like. I don't see any that have appeared so far. I think we're all so intently listening. Or if you'd like, you can raise your hand. I'll call on you, and we can go that way. We can also go the way of if a panel member wants to ask a question of another panel member. So at this time, I'd like to open it up. If you'd like to raise your hand, you can use your little reaction emoji. I can see you easily that way, but you could also just physically raise your hand, and we'll unmute you and you can ask your question, please.
Question?
Please go ahead, Vern.
I'm wondering if anybody on the panel is aware of recent additions to the amount of antibody testing that we're doing. I keep wishing that we had a lot of inapparent infections, and so that the number of, or the percentage of people who've had this virus would increase, so that we'd have a larger portion of the population immune. But I know Red Cross has done some antibody testing beginning in June, I think, or maybe May. But I'm wondering if there's anybody on the panel who knows about recent random surveys, not just sick people, but random surveys that show the number or the percentage of positive antibody tests in the population.
All right. Thank you so much. Great question. I know, Amy, you mentioned that you work with testing some as well. So I don't know if you want to speak to this, or Paul, or maybe briefly between the two of you, if someone would like to share, or both.
I'll just let Paul go first, and then I can chime in afterwards.
I'm not aware of randomized antibody testing in the population. I do know that it's pretty well established that 2/3 of COVID infections are asymptomatic. Therein lies a difficulty for any kind of testing. If an individual is asymptomatic, they're just simply less likely to seek any kind of healthcare or testing. As far as the usefulness of the antibody testing, I think it is good to know if an individual is returning to some type of work or some kind of capacity. I'd love to see more antibody testing available, and if that's also covered under other people's health plans as well. Some of the molecular testing is very clear going forward that that's covered by most insurance, as well as a lot of the care. I know Blue Cross and Blue Shield of Minnesota, I was told, covers care from all COVID-related illnesses. However, I'm not always sure that the antibody test is covered in all situations. As far as randomized studies, I'm not familiar with recent large studies of how prevalent it is. I think that based on the numbers of positive cases, you can infer things from that. So if you see the overall positive cases that are symptomatic going down, you can also infer that even if some individuals are being infected, it's at a lower rate as well, and therefore their antibodies would also be negative. Go ahead, Amy.
Yeah, thank you. Vern, that's a really good question. And I think the challenge with, there have been some studies elsewhere in the world that have looked at this, but many of them are very small in nature. There is a group in Southeast Minnesota that has been trying to get there's a process to do research and studies. There's a lengthy process to get everything to make sure that it's a valid research study. So randomization is part of that. I know that there's a group that has been meeting, I would say almost twice a month in the Southeast Minnesota area, looking at doing some randomized testing around the antigen and antibody testing. However, I think part of the challenge has been to be able to find, instead of doing a blood draw, can we do a blood stick? And so part of this actually was coming out of conversations we were having back in early as April and May. Obviously, the testing strategy and the ability to test wasn't as effective at that point in time. But there is still work on it. They're actually looking at using different processes. The testing site that I've been part of collaboratively working on, at one point in time, we had talked about actually having individuals go through that location. However, at the same time, there's a lot of resistance to that. I think the other thing that's throwing somewhat of a potential curveball in the testing, the longer we wait for this potential study to kick off, is the potential that we're starting to see some cases here in Minnesota that have been reinfections. So when we look at a reinfection, I think the original talk had been, let's look at 90 days, and people that potentially can test positive within that 90 days are still obviously positive. But once they start looking at people that have had negative tests within that 90-day time frame, they're starting to see individuals outside of that 90 days who are starting to see reinfection. And there's not a lot of research on reinfection. There are a few studies, but it's not as prevalent. So there's a lot of unknowns. I think generically, we all were hoping that if you got and became infected with COVID, you would have immunity and that would last for a long time. However, I'm not sure if that's going to be the case. There's just not enough research to say that it is going to provide herd immunity. The other side of it is, what does that do for the future of this virus and for the disease as it progresses through the population?
Thank you. Thank you both. And I want to just ask a clarifying question, Paul. I think you were the one that said up to 2/3 are asymptomatic. I had always heard the inverse, that up to 1/3 were asymptomatic. Could you clarify? Maybe I misheard, or maybe the information has changed.
No, there is a good number of patients initially thought to be 30 to 40%, but it may be even higher than that that are asymptomatic, and still maybe are able to spread the infection.
Okay.
And so that's a challenge for all testing and all care. And so it just reiterates the necessity to have preventions like utilizing a mask when you're going out, staying at home if you feel sick, getting the right testing at the right time in your possible infection as well. All those factors into your diagnosis and how you live your life to protect yourself and your family and friends.
Thank you. And we had a question come through the chat. And so here I'm going to read the question. Is test swabbing the throat less accurate than the nasal swab that a clinic will do? And I'm not sure if that's a question for a nurse or if that's a question for public health, but or anyone else that's on our panel, but I'm going to mute and let you take that. How about nasal swab versus throat?
This is Crystal, and I can say that our patients are doing the nasal swabbing. So that's all I can speak to. I don't know if one is more sensitive than the other. Amy or Paul, do you know?
Yes. So the nasopharyngeal swab that is currently done is being primarily used for the molecular testing, and it has a proven track record of very high sensitivity and specificity. The more recent saliva-based test that's being introduced to more people, the publications have shown that it should have similar or equal sensitivity and specificity. However, we don't know that yet in practice. So it's one thing to show it in a study, in a controlled group and on paper, and it's another thing to implement that into the general public and to see how that plays out. So I'm going to say it's going to be close, and it's going to be a tool that we'll need to use in testing, but the jury's still out on its application.
I'm not exactly sure what happened, but I think we lost Pastor Heidi, because I just got a note that said I am now the host. So I guess I'm hosting. So are there other questions? Was there someone else that had another question?
I have a question.
Okay, great.
Any of these panelists, would you recommend where we should turn in the next few months for accurate, updated information on the virus and future vaccination?
That's a great question, where to look for information. Thank you for that. Is there someone who would be able to speak on that?
Listen to Petrie dish. Yeah, that's a tough one, right? Because people are starting to wonder about whether the information they're getting from the CDC is accurate, whether from the WHO is accurate. You know, I would say have a variety of sources that are credible, that you trust, that have a long track record of good information. And, you know, avail yourself of them every day. You know, until further notice, I look at the CDC website every day. So yeah, so that's the thing, a variety of credible sources. Vaccine information is tough. I've done a whole podcast on it for Petrie dish, and the scientists are doing excellent work. And the concern, I guess, is about releasing a vaccine too soon, and the experts can you know, speak to that only because we're in phase 3 human trials right now. And, you know, the idea of releasing one now, next month, November, by the end of the year would be unprecedented. And, you know, let the experts speak to that. And and reporters who talk to the experts, you know, credible experts. That's what I do, is seek out the best experts. I'd like to defer to the experts on what information they avail themselves of as they proceed through this pandemic.
So
This is
I'll just,
Crystal. Oh, sorry. I was just
Go
going
ahead.
to say, I have the Mayo Clinic portal for myself and my kids, and they do a great job in there posting in your portal for all patients, quick Q&As. So that's where I tell my husband to go for a lot of his questions, because it's the last thing I want to talk about when we get home at the end of the day after I've dealt with COVID for 10 hours. I don't want to talk about politics or COVID, anything but. So I'm always telling him, go to your portal.
and I would just add one more thing in the context of public health. There's a lot of information that is usually updated on a regular basis, as Bonnie had alluded to, on CDC's website. I know our agency has people monitoring that website every single day looking for information. A lot of their pages on the CDC website give you a date when it was last updated. That's very helpful. The Minnesota Department of Health is another really good resource. There are county health departments in Minnesota. I know Olmsted County has quite a bit of stuff. And there are, you know, Winona's got some things. I can tell you that right now, from the state of Minnesota's perspective, we are starting to talk about vaccine distribution. It is going to be a phased approach. And there's a lot of details still coming out around that. But your local health department will be providing lots of information as they get that, as planning starts to come around related to that. So, you know, if it comes down to asking, where should I get it? When should I get it? Listen to your local health department. They will be able to provide that information to you. And I know somebody mentioned this earlier. I think it was maybe Bonnie, but you know, seasonal influenza is coming around the corner as well. And so if you haven't gotten your vaccine for that, I'm just going to put a plug for seasonal vaccination, because seasonal influenza is going to be going around. Hopefully our masking can reduce those infections just like it will for COVID.
All right. Thank you, Pastor Mike, for helping me out. I'm back. The Zoom kicked me off, but luckily I could go next door and pop in on Paul's, but it brought me back, so I'm really glad. It's 5:02, and I'm mindful of time. There was one other question about getting a test too early, and I'm wondering if somebody can just quickly talk about that, and then I think we're going to have to probably wrap it up. So unless that one was already answered, but I don't think so. It came in over the last question during the chat. Is there such a thing as being tested too early in your illness?
Paul, do you want to take this, or otherwise I can? I don't see Paul on here.
I don't see Paul
so
either. He must have disappeared too.
We lost him.
We lost him.
I see him. He's waving.
Oh, there he is. Unmute yourself, Paul.
If you want to take this, Paul, otherwise I can.
Did you hear the question, Paul? Are you not able to unmute?
I'm not sure what he's doing.
He's stuck. I think his mute is stuck. His, you know, he's on an iPhone, so it's not recognizing his touch. See, we're doing hand signals now.
Right.
All right. Well, we know the question asker, so I'm going to go ahead and say, Paul, you can ask that question, or you can answer that question for that person when we're done here. Okay.
Yeah, and I would just quickly add that there is a time frame as far as the nasal swab. From a public health perspective, I know lots of people are like, oh, I've been notified that I should go get tested, or that I might be a close contact. And so we recommend people wait a minimum of 5 days. If you're doing the nasal swab specifically, it's possible that you may not have enough virus in your system quite yet to be able to actually be detected. And I will defer to Paul, but that has been our recommendation from a public health perspective, is to try to wait that 5 days, if not a little longer, to go get tested.
All right. And he had his hand up like he was agreeing, correct?
That was exactly the incubation period for this virus. So so if you were in contact with an individual who was known to have COVID, it's recommended that you stay home. That would be the first thing that you would do. Not come into contact with other people. And then at that 5-day window, then if you're concerned, or if you have symptoms, or even if you don't have symptoms, to get tested for COVID.
Thank you.
And may I just say there's a window for flu too, right? Flu tests to be accurate. So for all of these things, we're heading into RSV season and adenovirus is going to be everywhere, and flu and COVID, and none of y'all want to get those both at the same time or one right after the other. So social distance, mask, stay out of large groups, get your flu shot.
Thank you. Very helpful. All right. I think we do have to wind up. I do want to say thank you again. Do panelists, was there anything we didn't cover that you want to make sure? Again, it would have to be real brief, like a bumper sticker. But if there's something else that you'd like to say before our closing prayer, I'd invite you to unmute and say so at this time.
I just want to say, wash your hands, wear a mask. Those are the two things that, and distance from people. And it's distance first, mask, wash your hands. If you do those things, you're going to prevent the spread of this contagious virus.
And I would just add, actually, Paul, you read my mind. Those three things, those are the same messages that public health has been saying for decades around infectious diseases. So what has worked for the common cold and in influenza and pertussis and anything else is the same thing that's working for COVID, with the additional layer of a mask. So by all means, this is not new information that we've been sharing. It's the same stuff. So when you teach kids in elementary school on how to wash hands, it's the same purpose. And I just want to say thank you, everyone.
Thank you. All right. Thank you, everybody. We're going to end with our closing prayer. Our denomination, the Evangelical Lutheran Church in America, has lots of resources related to COVID-19. Some things about practical health safety, guidance for churches, as well as prayers, advocacy, everything in between. Our national church body, but also our synods and individual congregations are all united in our concern for the neighbor in this pandemic. So I think our best resource, you heard them all today, is one another and certainly prayer as well. And that's how our time is going to end. So there's going to be a couple of moments where there's going to be a silent pause in this prayer that will allow you to name specific persons that you may wish to pray for. Okay, let us pray. God, our peace and our strength, we pray for our nation and the world as we face continued uncertainties around coronavirus. Protect the most vulnerable among us, especially all who are currently sick or in isolation or struggling to recover. We remember all who have died in the pandemic, knowing that you meet each one with your eternal love. Grant wisdom, patience, and clarity to healthcare workers, especially as their work caring for others puts them at greater risk. Guide us as we consider how best to respond in our families, our congregations, our workplaces, and communities. Give us courage to face these days not with fear, but with compassion, concern, and acts of service, trusting that you abide with us always. Through Jesus Christ our Lord. Amen. So panelists, participants, God bless and keep each of you in tender mercy and unending grace. Our Zoom is now adjourned. Thank you for coming.